Let's now move on to our new regular segment for Mondays, where we turn to a medical expert for a more in-depth diagnosis on the current issues surrounding COVID-19. For this, we have Dr. Alice Tan, internist at MizMedi Women's Hospital via Skype. Dr. Tan, thank you for joining us.
Thank you for having me.
Now, just a few hours ago, like we said, Dr. Anthony Fauci, the U.S. top infectious disease doctor, stressed the need to speed up booster shots for people with weakened immune systems. Now, this is something many are focusing on, as we've been hearing information that the efficacy of vaccines gradually decrease post-vaccination. What are your thoughts on this, and do you think a booster shot is necessary?
I think that a booster shot will be necessary. The questions to ask are who should receive it, when should they receive it, which product should they receive, and how should they be deployed. In terms of who, I think your previous segment alluded to elderly and people who are immunocompromised should be first in terms of priority for receiving a booster. In terms of which product, I know that the manufacturers for the mRNA vaccines and also AstraZeneca, they're working on modified, updated versions of their boosters to better tackle the circulating variants. And so it would make sense to use an updated version once they are emergency approved. In terms of when, we did expect, and we know that immunity will wane with time. Most experts are saying that a booster for these most vulnerable groups should be administered by the end of the year. And in terms of how, that's going to be logistically challenging in countries such as South Korea, where the ongoing vaccination campaign for first doses is still in its height. And so trying to time boosters is going to be complicated, but it is something that needs to be looked into in order to prevent death due to COVID-19.
Now, Dr. Tan, we are also hearing more cases of breakthrough infections where people who have already been vaccinated still get infected with COVID-19. Can you explain to us the reason behind this? And are people who only have received one shot more prone, or are the chances of infection the same for those who are already fully vaccinated?
So we expected breakthrough infections to occur even in the phase 3 trials of all the vaccines. We saw cases of COVID-19 despite full vaccination. We're not sure exactly why. We're not sure why some people don't develop good enough immunity to prevent infection. But we do know that the vaccines that are currently in use have very high effectiveness against the circulating variants, against protecting against hospitalization, that is. In terms of the definition of breakthrough, the most accurate definition refers to people who have been fully vaccinated. In other words, receiving 2 doses of a 2-dose vaccine or 1 dose for, in the case of Janssen. We know that after just 1 dose, the efficacy is much lower than after having been fully vaccinated. For example, after 1 dose of the Pfizer or AstraZeneca vaccine, vaccine effectiveness is only about 31%. However, if you receive both doses and full immunity happens 2 weeks after the 2nd dose, then the effectiveness will go much higher. For Pfizer, the effectiveness, even in the case of the Delta variant, is about 88%. And for AstraZeneca, the vaccine effectiveness is about 67%. After full vaccination.
Now let's turn to the current situation in South Korea. Well, the nation reported the highest figure for a Sunday, and today we are expecting more than 1,500 new infections. Now, many point their fingers to the more transmissible Delta variant for this. Now, can you remind us how much more transmissible is this Delta variant compared to other types? And also, can you tell us about its fatality rate?
Right, so we know that the Delta variant is much more transmissible than the original strain. So if the original strain, if one infected person would infect 2 to 2.5 other people, With the Delta variant, that number, the basic reproductive number, is somewhere between 5 and 8. In other words, one infected person can pass the infection on to 5 to 8 other people. And people have said that it's about as infective as chickenpox, which is a very infectious disease. So this is the reason why people need to really adhere to public health and social distancing measures, because the only way other than vaccination to keep this Delta variant in check is for people to stay physically apart. And so right now, many of the children, adolescents in South Korea, of course, they have not received their vaccinations yet. They are not protected against the Delta variant. We need to protect them. They need to be, really kept away from crowded places. And then the other caveat, I would say, at this point in South Korea, especially in the Seoul metropolitan area, which is such a population-dense region, I would stress that the use of public transportation should be seen as a very high-risk situation. I don't think it's been adequately addressed, but anyone who's been on the subway in rush hour, they know how tightly packed it can be. And even though everyone is wearing a mask and sanitizing their hands, there is still the risk of the Delta variant being spread in a subway car, even though the risk is low. If it were to spread in public transportation, it would be very difficult to control. And so that is something to be careful about.
Can you also tell us about the fatality rate of the Delta variant?
So the fatality rate, the risk of hospitalization is known to be higher compared to the Alpha variant and the original Wuhan strain. But the good news is, in terms of protection against hospitalization and death, people who have been fully vaccinated with any of the vaccines that are approved, the risk of hospitalization and death is still very low. And I think that's the news that needs to be emphasized over and over again. Some people mistakenly think that the vaccines don't work against the Delta variant, and that is absolutely not true. People who have received full vaccination are well protected against hospitalization and death due to COVID-19, even in the face of the Delta variant.
So we definitely have to get vaccinated. Now, as many already know, South Korean health authorities extended the current level of social distancing for another 2 weeks beginning today, saying that they will ease some restrictions if a drop in infections in the near future is evident. Now, you've slightly touched upon the public transportation issue, but do you think this measures under level 4 are enough in curbing the spread?
Well, right now, the virus is being suppressed. All of the social distancing measures are keeping levels from getting above 2,000 new cases a day. However, what the problem is as these cases accumulate in hospitals and in ICUs, there will come a point when there is no more space and the hospital systems will be stretched to capacity. At that point, the current level 4 measures will not be enough, because even if we're able to keep the levels right around 2,000 or below, as I said, the accumulated number of patients will make it such that it will be difficult to sustain and deliver high quality medical care, if there are just not enough ICU beds, not enough ventilators to take care of not just the COVID patients, but all of the other patients who need medical care.
So going further, do you have any recommendations for us to better prevent ourselves from getting COVID-19?
I think in terms of the mindset, South Korea has done a very good so far relative to other countries in terms of keeping COVID-19 in check. But we need to understand that the Delta variant will take intensified effort. So whatever South Korea has done so far is not enough to control the Delta variant, because it is so much more transmissible. I said the reproductive number is between 5 and 8. In other words, whatever South Korea has done up until this point, the level needs to be intensified even more to try to keep the level the same number of controls. So all of the public health and social measures, the ventilation, hygiene, avoiding crowds, masking, universal maskings everywhere, whether or not you've been vaccinated, indoors and outdoors. These measures need to be adhered to very strictly. And in terms of vaccination, when it's your turn and you're able to get online and make your appointment, please, everyone does need to get vaccinated as soon as possible, as safely as possible.
Thank you, Dr. Tan. I'm afraid we have to wrap up our discussion for this week. This was Dr. Alice Tan of MizMedi Women's Hospital. Thank you so much for your wonderful insight. We will see you again next Monday.
Thank you for having me.